Patrick has been a world traveler the last month. Two great Odyssey events around the world. I'd love to hear a little bit more about both of them. Let's start in Europe. July 1st to the 3rd, the Europe Symposium in Rotterdam. You want to just talk about what seemed like a great event with a lot of research shared by the community?
Yeah, the Odyssey Europe Symposium was another key event for our community, and particularly for our European colleagues, who really were able to showcase the tremendous progress that's been made across the whole of Europe, and indeed internationally. I want to particularly thank our colleagues at Erasmus MC for hosting a great event. We had 2 days of fun workshops and tutorials and work group activities at Erasmus MC, and then we had a main symposium day on the SS Rotterdam. Things that really stood out for me, really the tremendous exponential growth in the European community, where historically there has been limited access to data, and through the progress of Eden and other European efforts, we're now seeing hundreds of databases that have been standardized and made more accessible for research, and we're really seeing promising research come out of that. The other thing that really stood out was these large European efforts that are really making dedicated efforts towards specific diseases. Showcased at the Odyssey Europe Symposium was the HonER program, the EuroCan program, Pioneer, and Optima, showcasing specific efforts to bring real-world data to specific disease areas and making really good progress on network science. And the other thing that was really cool at the Odyssey Europe Symposium was celebrating the national nodes. We saw work from Belgium, Germany, Greece, Italy, Luxembourg, Netherlands, Portugal, Spain, United Kingdom, all sharing the work that they're doing nationally and how they're bringing that to the broader international community. And so it was great to see the progress that's been made, great to see the community that's being built, and great to really get the positive energy that comes from yet another Odyssey community event.
We plan to have those presentations posted on the Odyssey webpage and on our YouTube channel when they're available. We do have the posters. I know it was a record amount of posters shared at that event. They are available now on the Odyssey website. And of course, that allows us to restart the social showcase. So hopefully everyone is following us on Twitter or LinkedIn because you'll get a sense of the great work that is going on. A couple weeks later, the Odyssey Asia-Pacific Symposium in Sydney, Australia. I know they were really excited about the amount of people that joined that event, and the research shared there as well. 2-day event, 1-day conference, 1-day tutorial. What did you take from that day or those 2 days?
Yeah, Nicole Pratt and her entire team at the University of South Australia did a great job hosting us for the Odyssey APAC Symposium. It was really exciting for me to see so many folks in Australia come together from different academic institutions, government agencies, who all have a clear need to try to figure out how to learn more from healthcare data across Australia, recognizing the fragmented healthcare system that Australia has, but really seeing some tangible progress towards data standardization within their state hospital systems, across their GP systems, making use of their national pharmacy data. But in addition to the great progress that's been made in Australia, we really saw a lot of great inroads across the entire APAC community, and it was great to see the regional chapters represented and highlighting the progress that's been made in many countries, and with a particular clear interest in trying to figure out how we can facilitate research, not just within the APAC community, but bringing that to our global community with leadership in studies, as was presented. One of the Sisyphus Challenge studies was presented as an example of a study led by the APAC community with contributions from the broader global community, and how that evidence could be brought to bear to support regulators, clinicians, and patients in making better decisions. The Odyssey APAC also was celebrated lots of posters from the APAC community, which was really great. And then to have hands-on workshops and tutorials to develop competencies and to establish even better relationships within the community member was really great to see.
So similar to that, we're looking forward to getting those presentations and posters available on the APAC Symposium homepage as well. Now we turn our attention to the Global Symposium, which is still two and a half months away, but there's a lot to talk about during that event. We'll get more into the agenda as it's detailed and the collaborator showcase, which I know our review committee is hard at work on reviewing over 170 posters and other types of submissions. But we have talked a little bit about the How Often workshop. It's going to be 2 half days, Saturday p.m., Sunday a.m. There was a session, a community call in June about it, and another one coming up in August in terms of preparing the community to be successful in that event. For anybody who may have missed it or just wants to hear a little bit more about it, can you talk about the How Often initiative and what it's all about and what you hope to accomplish at the symposium?
Absolutely. So OHDSI is all about doing large-scale analytics, and we have 3 primary areas we focus. We focus on characterization for disease natural history, focus on estimation for causal inference of safety surveillance and comparative effectiveness. We focus on patient-level prediction. And in the characterization space, one of the most impactful uses of real-world evidence is to estimate incidence rates. And as our community has already directly contributed during the COVID pandemic, we know that calculating background rates for specific diseases is something that's going to be pivotal to support regulatory and clinical decisions. And so with the progress that we've made and some of the methodologic research that we've conducted over the last several years, we recognize now's the chance for us to rally together as a community and to develop a large-scale approach to computing incidence rates across our network of databases. And so George Ripsack and I have been introducing this idea that we want to reinvigorate the idea of How Often as a public resource that provides us characterization of incidence rates for all target populations and all outcomes to make that information accessible to the entire research community. And to do this, we know that we need to bring together the entire community to develop the phenotypes for what target and outcome populations, to develop the statistical models to produce those incidents, and to be able to execute a large-scale network study. And then we really need to figure out new innovative approaches to how to disseminate that evidence to those that want to take use of it. So at the OHDSI Global Symposium, we'll be spending a day together, rallying together on how to work through these problems. But as homework for that, we need to now work on the phenotype development and evaluation process. And so we're looking to have a call to action for our entire community for those that are interested in getting background rates and incidence rates of specific clinical diseases or specific health outcomes of interest. We're calling for you now to develop those phenotypes and contribute them to the OHDSI Phenotype Library. And all of those outcomes and phenotypes that get into our library will be used as part of the How Often program coming into our October symposium.
That'll be part of our August 15th community call. We have other sessions on OMOP supporting clinical registries, the vocabulary release, a chance on August 8th for some new members of the community to introduce themselves, talk about why they've joined OHDSI, how they hope to help, and maybe how the OHDSI community can help them. So should be a really fantastic month. And we are now kind of in the countdown to the Global Symposium, October 20th to 22nd. If you're looking for more information, or obviously if you want to register, all the details are on the OHDSI website. Thanks, Patrick.
Thanks, Craig. Science!